Everyone, my name is Simona Jasaityte, and I will tell you about Parkinson's and Movement Disorders Families Project, or short, PFP, which is a study based at University College London, and it is a study focused on the genetics of Parkinson's disease. So I will tell you about the aims of the study, about eligibility criteria, about the procedures of the study, the current state of recruitment, how we analyze samples, and our goals for the future. So this is the study team. That's me, the study coordinator. So I coordinate the study sites across the UK. And we have my colleague Megan, who is usually the first point of contact. So if you would like to take part in the study, she'll be the one who will introduce you to the study, go through the consent procedures with you. And we have our newest member of the team, Tatiana, who makes sure that everything runs smoothly and all the administrative tasks are taken care of. And we have Professor Hugh Morris, who is the chief investigator of the study. And I'd like to thank the co-investigators, one of which is Professor Tony Shapiro, so thank you very much. As I mentioned, it is a UK-wide study, and we have 44 recruiting sites across the UK. So if you would be interested in taking part in this genetic study, but you're not based in London, that's not a problem at all. I can always refer you to another site which is closest to where you are based. And actually another option, if there isn't a site close to your home, we also have an option to do remote recruitment and blood sample collection with the help of GP practices. So just a quick slide on Parkinson's disease. So it is the second most common neurodegenerative condition, and it is thought to have a multifactorial etiology involving the role of genetics modulated by environmental exposures. Although the main risk factor for developing Parkinson's disease is advancing age, many common genetic variants have been associated with increased risk of developing Parkinson's, and also several rare variants can cause Parkinson's disease. And for the vast majority of familial Parkinson's cases, so those are individuals, cases where multiple generations in the family are affected by Parkinson's. So for those familial cases, a known genetic cause has not been identified. Family history and early onset of Parkinson's disease are thought to be the main factors associated with known monogenic forms of Parkinson's disease. So this is kind of the rationale of why we're interested in recruiting early onset individuals with early onset of Parkinson's and individuals with familial Parkinson's disease with several members affected in the family, because a known genetic cause has not been identified for most of these cases. This suggests that more variants are there to be discovered. So the main aim of Parkinson's and Movement Disorders Families Project is to identify gene changes that might cause or increase the risk of Parkinson's and other movement disorders. So it started off as being only a Parkinson's study, but a couple of years ago, we've introduced other movement disorders as well, such as progressive supranuclear palsy, multiple system atrophy, cortical basal syndrome, and essential tremor, and so on. And we want to identify these gene changes by identifying families with early onset and familial Parkinson's disease and movement disorders. And as I mentioned, these are the categories of Parkinson's cases that have a likely genetic cause to their disease. And so our DNA is like a string of 3 billion letters, and it acts as an instruction manual for all the processes in our body. About every 1,000 of these letters, there is a variation between people. And most of the time, this variation is benign, it is not harmful, and it is associated with benign differences between people, such as eye color or hair color or height, and so on. But sometimes this variation in the DNA acts as a spelling mistake and makes the instructions for our body unclear in some cases, and that could be a cause of disease. So we're interested in identifying these the spelling mistakes in the DNA in this project. And because it is there is so much variation in the DNA of all individuals, it is quite difficult to pick out which of these variations are the ones that are harmful. Because family members share a lot of DNA, it is very useful to compare the DNA of individuals who are affected by Parkinson's or another movement disorder and their unaffected family members as well. And that is because we can then identify which of these variations are present in individuals with Parkinson's and that are not present in their unaffected family members. And we think that that could help us identify these new mutations. And then a second goal of this research is to establish a network of affected families and patients carrying mutations who are eligible to participate in future studies and clinical trials. So when individuals want to take part in the study, they sign a consent form, and one of the items in the consent form allows you to opt in if you would like to hear about any clinical trials that you may be eligible for in the future. So this would act like a registry of individuals who are interested in taking part as well. And finally, we're hoping that expanding our knowledge on the genetics of Parkinson's disease will help us inform new and better future tests and treatments of Parkinson's. And just to mention the inclusion criteria, so an index case is the first person recruited to the study in the family. So it's someone affected by Parkinson's or another movement disorder. And as well as having a diagnosis, this individual began experiencing their symptoms before the age of 45. So that is our early onset category. Either or they have one or more affected individuals in their family, or another way to participate is if an individual has already had some genetic testing. Let's say they had an NHS testing and they know that they already carry a genetic mutation associated with Parkinson's or another movement disorder, so they are also able to participate. So early onset or familial or unknown mutation individuals. And then, as I mentioned, we also recruit their affected family members and unaffected relatives. And this is what the procedure looks like. So there are slightly more assessments for the affected individuals than the unaffected individuals. So we collect blood samples, slightly more blood tubes for the affected individuals. The participants complete questionnaires at home. The affected individuals complete a questionnaire on their symptoms, and then all individuals compare questionnaires on the family history of movement disorders and other medical conditions, on their own health and on any environmental exposures, medications they take, and so on. We have an interview on the family history. We draw a family tree, and then we completed an interview on the symptoms with affected individuals. We complete a movement assessment, already mentioned by Professor Shafira, the UPDRS, and yes, UPDRS. And then we also complete a very short cognitive assessment called MOCA to see how processes such as memory work in these individuals. And just to quickly mention, the DNA samples are DNA is extracted from the blood samples that we collect, and they're analyzed using a wide range of techniques. At the moment, we're mostly focusing on collaborating with a project called Global Parkinson Genetics Program, and they help us with whole genome sequencing and genotyping our samples. And those are techniques that allow us to see the genetic constitution of an individual, to kind of unravel that string of letters. So at the moment, I would really like to thank all the individuals who have already taken part. So since 2015, 1,449 participants have joined the study. 1,107 are index cases, so the first participant recruited to the study from the family. We have 67 affected relatives, and we have 210 unaffected relatives who have joined the study. And this is a quick overview of what recruitment has looked like since the beginning in 2015. So we had a big spike in 2016, and then we see also a very significant reduction during COVID times, of course, and now we're back to similar numbers of individuals joining every month to 2019, and about 20, slightly over 20 individuals join the study every month. And just to see who are our index cases, so most of our index cases who've joined the study have a family history of Parkinson's disease or another movement disorder. The second largest group would be early onset participants who began experiencing their symptoms at or before the age of 45. And the third largest group is both early onset and familial patients. And just to look at the future aims, so we have 8 years remaining of recruitment. The study is set to end in 2030, and our recruitment target is 2,400 individuals be recruited to the study. At the moment, we are still hoping to recruit 1,000 participants. We're preparing a baseline research paper where we overview the mutations identified so far. And yeah, we will continue analyzing our samples through the Global Parkinson's Genetics Program. Thank you very much for listening. Here are my email addresses. There is also the website if you would like to learn more about the study. Yeah, please feel free to contact me on any of the email addresses. And yeah, looking forward to hearing from you. And please let me know if you have any questions. Thank you so much.